Hi, everybody. I'm Kristi Maas. I'm a reproductive endocrinologist at Reproductive Care Center in Sandy, Utah and Clearfield, Utah. I am originally from Wyoming, grew up in the Rocky Mountains. I trained at the University of Utah actually for a decade. I did undergraduate and graduate school in the Department of Biomedical Engineering before going to medical school at the University of Utah to obtain my medical degree. I then went to Maine Medical Center for residency in obstetrics and gynecology in Portland, Maine for 4 years, and trained at the Boston IVF Beth Israel Deaconess Medical School Reproductive Endocrinology and Infertility Fellowship in Boston, Massachusetts. After that, I went into private practice in San Diego, California for 5 years before having the opportunity to rejoin the Utah community and serve the people of the Rocky Mountains where I grew up in Salt Lake City, Utah, and the expanding area. My journey to become a reproductive endocrinologist was clearly not straightforward. And I had the most amazing experience during my OBGYN rotation, which allowed me to build lifelong bonds with patients. And this continuity of care throughout a patient's life really called to me. And it's a patient population that I feel is underserved and really deserves the care and the compassion that I think the team at RCC and myself are able to offer. My patient care philosophy is education number one. I view myself as a resource to help teach you about your own health, your fertility, and your options. I give you information, I give you recommendations and guidance, and it's your job to try that on for size and figure out what the right answer is for you. I like to be available to my patients, and I love it when you come in with your list of questions so that we can make sure you get out of the appointment what you need. Having the opportunity to return back to Salt Lake and the Rocky Mountain area really resonates with me. Growing up in small town Wyoming, my family always had to travel for specialty care. And I see that with our infertility patients as well. You don't have direct access to care when you live in some of these rural and more remote areas. For better or worse, COVID has allowed telehealth to provide expanding access to care, but also being back here in Utah with my people, my Rocky Mountain colleagues, my friends, their friends, our family. It's an honor to be able to serve the individuals that I grew up with in communities that I know that are underserved. Patients who wish to build a family inspire me in so many ways. This is a challenging process. We know that the emotional impact of the infertility journey is equal to the emotional impact of a diagnosis of cancer. Our infertility patients are warriors. You're out there every day fighting the fight and inspiring other people through your journey. I am so honored to be able to be a part of my patients' journey, for them to share their vulnerabilities and their story with me. My advice for individuals starting their journey is to hold on. It's very rarely straightforward. It's very rarely what you expect. And please know that I and my team here at Reproductive Care Center will be with you every step of the way and holding your hand. And at the end, hopefully the journey's worth it for you.